affected side. You want to make sure to start with a flat bed. Okay, so yep, this knee's going to come up. This hand's going to support that hand and kind of do that. Now, again, that's better. You didn't need to be scooted. If they need to scoot over, you can use the chuck pad or you can walk them through how to bridge. So I would have my hand here and then here to kind of get them to bridge over. Okay. So yeah, she can pull straight up and then kind of do like a chopping, and I can help wherever I need to, whether it's here or here. Okay. Then we're gonna have this hand just laying flat. This hand's gonna come right here. Okay. You gonna see where we're at? Now this hand can come here if the patient prefers, but I really like this. Now this is their strong side, okay? I really like having it here. I think it gives them a nice leverage, okay? So since I'm gonna have her use the mattress, I'm gonna put this down so that way I can get to her arm here, okay? And so first thing I'm gonna have her do is I'm gonna show her how to take this strong leg and hook the ankle of her weak leg. So she's gonna hook it just like that, okay? And then I'm gonna take her affected side arm, I'm gonna come underneath of her, and I'm gonna kind of protract that scapula, and I'm gonna kind of cradle her arm in my arm, okay? So I've got her arm supported with under my arm, kind of in my armpit a little bit, okay? But that's just where it settles nice and comfortable there. I'm gonna get a lateral stance, okay? Nice wide base support. Her ankle is hooked down there. So then I'm gonna instruct her to push with this hand and use this good leg to kind of kick the legs off the bed and push with this hand at the same time, okay? Where I'm gonna help is I'm gonna laterally weight shift, and I'm gonna help support her arm, and I'm gonna help here at the hips. If I need to help down here, I can, okay? So on the count of 3, we're gonna sit up, okay? All right, ready? 1, 2, 3. Okay? So once they sit up, make sure that they're, not dizzy, lightheaded, all that good stuff, okay? And then notice I just kind of put her hand down here, or you can put her arm in her lap, however, whatever position is going to be the most supportive at the moment, okay? So from here, we do want to have her, let me see if this bed is as low as it goes. Okay, so we do want to have her scoot forward. So this is where you're going to do a little bit of like an NDT technique, okay? So I'm going to kind of come in front of her, and then this is her affected side, and I'm going to be at those key points of control, okay? So I'm on the trunk over here, getting her to side bend over there. I'm up here toward the shoulder, getting her to kind of weight shift there, and then I'm going to come down here, okay? And then she's going to scoot this side, and then, okay? So that's kind of your NDT technique that you're going to incorporate into this, okay? Then she scooted nice. I like this position. Some people might say that's too far, but I like it. I like about 3/4 of the leg off the bed. I'm still right here with her, okay? I'm going to apply the gait belt. You can still ask them how they're feeling. Make sure that arm's supported, okay? And then snug but breathable, right? Okay. And then I'm gonna pull my wheelchair up here, okay? I want the wheelchair on the strong side, okay? So we're gonna have her roll toward the weak side, but we're gonna have her do that stand pivot toward the strong side, okay? And I'm getting pretty close, as you can see. I'm gonna lock the wheelchair, then this leg, which is her good leg, I want her to put that heel back toward the bed. Yep, as far as she can, okay? She can angle it a little bit if she wants to. This leg, we're gonna keep out a little bit, and I'm gonna block it, okay? Now blocking it can look a little bit different depending upon the amount of assistance that the patient needs, okay? So if I feel like, you know what, she's gonna need, like, I'm gonna need to have a nice lateral stance to be able to get her up, like a mod to max transfer, then I'm gonna probably stand like this and have my leg kind of like that, like this, and then have like that 1 foot in front of the other position, okay? So that way I can weight shift, okay? If I do it just like this, see how that puts me kind of a little bit of a disadvantage because I have a smaller base support and I don't have that AP stance, I have that like lateral stance, so I don't have that ability to weight shift onto that back leg, okay? So, min assist, you can do it like this. Even, you know, like mod to max, you're gonna have to come in like this. You can do this way. You can do, let me move this. You can do like this. Sorry, go ahead. You can do kind of like that, okay? The arm depends upon what the patient can do. You can cradle the arm, okay? So I can come in and kind of cradle it like this, and I still am able to grab the gait belt. I'm still gonna have that ability to weight shift, okay? Or you can come in this way and, hold on. This one would be like this, okay? Or, there's a lot of options, sorry guys. Or they can push with this hand on this affected side, okay? And you can even help them to do that, okay? See how I'm kind of helping her push that hand through the affected leg? That's more of, again, kind of an NDT technique. And you can do that from the side, okay? So, I think the one that works the best for you guys, the one that you seem to feel like the easiest, is kind of coming more from the front. You can still try to do a little bit of an AP stance if you want, coming from the front, and then just doing this. That seems to be what works best for you guys. So this hand, push from this hand, push from this leg. We're gonna stand. Once we stand, you can grab my elbow with this arm if you want. We're gonna just do a little pivot. Once you feel the chair on the back of your legs, you can reach back with this arm for the armrest, okay? And I'm gonna be blocking this leg. All right, ready? 1, 2, 3. And then I'm staying on her leg the whole time. And then